Hi, I'm Dr. Alyssa, a naturopathic doctor, and in today's video we're talking about serrapeptase, a fascinating enzyme used to help support inflammation, pain, and tissue healing naturally. It's sometimes called the miracle enzyme for recovery, and for good reason. So let's go over what it is, how it works, its top health benefits, and how you should take it properly. Let's start with what is serrapeptase. Serrapeptase is a proteolytic enzyme, which means it helps to break down proteins. Now, serrapeptase was originally found in the gut of silkworms to help dissolve their cocoons, and it actually has a similar dissolving action in humans as well. When taken as a supplement, serrapeptase helps to break down non-living protein debris, things like fibrin, scar tissue, and inflammatory byproducts, which all help to support natural healing and reduce swelling. Now let's talk about how it works. Serrapeptase helps to reduce inflammation by breaking down inflammatory compounds at the site of injury or surgery. It also helps to support circulation and drainage, as well as tissue repair and recovery. And unlike pain medication, which simply just blocks the inflammatory signals, serrapeptase works on the underlying cause, helping your body clear out what's not needed so it can help to heal more efficiently. Now let's talk about the health benefits. It helps to reduce pain and swelling, especially after injury or surgery. It also helps with sinus congestion and post-nasal inflammation. It supports scar tissue breakdown and healing, as well as improving joint comfort and mobility. It also promotes vascular health by reducing fibrin buildup. Now let's talk about how to take it. A typical dose is 40,000 to 120,000 SU or serrapeptase units daily. Now it's best taken on an empty stomach 2 hours away from meals for best absorption. Also, avoid taking it with protein or digestive enzymes as it's best taken on its own. Now, a note on safety. Serrapeptase is generally well tolerated and safe, but it does have mild blood thinning effects, so it shouldn't be taken before surgery or if you're on any anticoagulant medications. Occasionally, it can cause digestive upset, especially when first starting it, so you could always start low and then increase your dose if needed. So that's serrapeptase, a natural enzyme that helps to reduce scar tissue formation and help with natural healing. So if you're looking for a way to reduce chronic inflammation without using pain medications, then this might be the right supplement for you. Let me know in the comments, have you tried serrapeptase before, and what did you use it for? If you enjoyed this video, please make sure to like and subscribe. Thanks so much for watching, and I'll see you in the next one.